Your chances of recovering from a heart attack are much better nowadays when all the high-technology medicine of a coronary care unit is provided for the emergency patient. But heart disease is, even so, the biggest single killer in Britain, and most of these deaths come from a heart attack. Much medical research is now concentrated on the precise moment a heart attack starts. If we could find out exactly what triggers it off, we'd have a better idea how to prevent it. So they developed new microscopic filming techniques to show just how the blood flows in veins and arteries. This has focused attention on the bodies called platelets, which most scientists believe are a key element in heart attacks. Platelets are the body's repair kits or first aid boxes. There are millions of them, containing many special chemicals. They're very sticky, and at the least provocation they suddenly join together to make easily visible clumps. If there's any damage to a vein, then the job of the platelets is to rush to the scene of the bleeding. Using their ability to clump together, the platelets try to stop the blood flow by making a living plug, which will block up the hole in the vein. But this life-saving activity of the platelets can also make them potential killers. For if one of these plugs of platelets breaks away from its anchorage, then it's a clot, which can block the entire blood flow and cause a heart attack by stopping up the blood supply to the heart muscle. 3 years ago, here at the Wellcome Foundation Laboratories in Kent, an important discovery was made. They found a substance called prostacyclin, which is manufactured by our veins and arteries, and which stops platelets from clumping together. This gave the researchers a clue about the precise mechanism of the start of a heart attack.
Well, this is a situation where we believe there is a lack of prostacyclin, and the lack can be brought about for various reasons. One of them is that there can be fatty deposits on the walls of the artery, and the fatty deposit covers up the cells that make the prostacyclin, so that here you create an area inside the artery which is susceptible to platelets sticking to it. And when the platelets find one of these fatty deposits, and maybe the fatty deposit ruptures, then they'll form a clump and stick. And if the clump gets big enough, it will occlude the artery completely, and that will be a heart attack or a stroke.
They're called fatty plaques, but really they're quite hard, hardening of the arteries. And this gives rise to an opposing theory.
The plaques sometimes break, crack, or fissure. It really all means the same thing. It is as if whatever stresses they are subject to suddenly cause some damage, rather like the cracks or fine fissures that develop in aeroplane wings when the planes have been on the go for some time. There it's a case of what's called metal fatigue, rather worrying. Here it's a cause, what underlies that we don't know, but one could imagine it is similarly something that gives in the wall of this hardened artery. If that is the case, the rest of the process is easier to understand, because a platelet block or thrombus made, of course, of millions of platelets would then resemble what happens exactly when you cut yourself anywhere. Because when you cut yourself anywhere, the platelets form what is called a hemostatic plug, which is simply a plug to stop the blood emerging from the cut. Now, similarly, when a crack forms in a coronary artery, a small hemorrhage occurs into the wall, and there you have the similar situation. The platelets form a thrombus.
Research to resolve the differences between these two theories is one of the present frontiers of medical science. A guinea pig heart will continue beating even when it's isolated in laboratory glassware, and it will continue to produce the chemicals it produces in the body. It was in an experiment like this that prostacyclin was discovered, detected by its different actions on various different types of animal tissue. The researchers here reason that if prostacyclin naturally stops platelets clumping dangerously, it could be used as a drug to prevent us getting heart attacks, or even to reverse the process once it's started.
We are hoping that within a few years we'll be able to do that. Now, with prostacyclin itself, we can only use that intravenously, and we think perhaps there will be a utility for prostacyclin after a heart attack if we can catch it early enough. When you have a heart attack, the initial event is for the platelets to stick together and form a clump. After that, the clump is consolidated within a few hours into a major blockage. If we can give prostacyclin before the consolidation takes place, then we believe we can dissolve the clump and so reduce the area of the heart which is damaged. We won't be able to use prostacyclin apart from intravenously because it's unstable and we can't take it by mouth. But we are hoping to find chemicals that retain its activity, which are stable and which can be taken by mouth. Now, if we can do that, within 5 or 10 years, we may be able to prevent heart attacks.
You mean I could take one of these pills every day and just not have a heart attack, we hope?
That's what we hope, yes.
If the scientists can make such a drug in their laboratories, it'd cause something of a revolution in medicine. But Professor Born is less optimistic.
Prostacyclin and similar agents which prevent the platelets from forming a thrombus could have a future as a drug. Mind you, it's very early days, and it is possible that the mechanism is so much more complicated that even prostacyclin isn't going to take care of it sufficiently well.
Even if the medical research scientists do come up with a drug which will prevent us from having heart attacks, the villains of the piece are still those fatty plaques which form in our arteries and cause the danger. Those fatty plaques, the doctors warn us, are caused by eating too much fatty food, smoking cigarettes, not taking enough exercise, suffering the stresses of modern city life, or whatever is the fashionable vice of the day.